Well, each and every day there's a lot of new information about the coronavirus and a lot of questions that you want answered. WBZ's Dr. Mallika Marshall joins us now to answer some questions from you, the viewer. And Doctor, let's jump right in. Jacqueline writes on Instagram, I'm 27 weeks pregnant. First of all, congratulations, Jacqueline. I've developed a deep, painful cough. Do I call the OB or do I wait?
So I would say, Jacqueline, if you have a persistent cough, especially if you have a fever, of course you should give your OB a call. You may not meet criteria for testing for coronavirus, but at least they can give you some advice over the phone as to what to do. And anytime you have a question, I would not ever hesitate to call your OB.
All right. And Dorothy on Facebook to ask, is the sore throat that is mentioned like a scratchy allergy type throat or I swallowed glass type of throat?
So you're probably asking because some employees are being asked to stay at home, even if they just have a sore throat. And of course, people are suffering from seasonal allergies right now, so they might have some irritation, they might have an itchy throat. But I would say if it's painful to swallow, and especially if you feel like you're coming down with something, you should definitely stay home.
By the way, using all the bleach and the sanitizers and the Lysol, that can start to bother the throat as well. Neil in Westwood asks, is it safe to bike outside with friends? Mallika?
So I would say if you're feeling well, that it's okay to go for a bike ride near your house, but I would only do it with people that you live with. I know there are groups of people that want to go out and bike together, and they have the best intentions to sort of keep safely distant, but chances are you're going to stop for a water break and you're going to chat and you might inadvertently touch someone, and it really isn't worth taking that risk. So I would say bike alone or bike with people in your household.
All right, good advice there, Doctor. And Laura writes on Facebook, should the families of healthcare workers take extra measures to protect the public since the healthcare worker could bring the virus home?
Laura, I would say definitely yes, and it brings up a good point that a lot of healthcare workers are having to make some really difficult choices themselves. I have colleagues who are literally sleeping in their basement or in their garage, afraid that they're going to bring the virus home to their family. I actually moved away from my house 2 nights ago and left my kids behind because I was worried that I might come into contact with people with coronavirus and possibly infect them. So I just want everybody to think about that and sort of send a thought out to those healthcare workers out there, especially when you're becoming stir crazy and going nuts with your own families in your homes.
Oh, that makes me sad, Doctor. I know how much you love your family, and to be away from them, that's really tough. So thank you.
I do.
Thank you to all our healthcare workers out there. Dr. Mallika, thank you so much. Lisa, over to you.